Yet now, as new challenges arise and the world evolves, their mission faces its greatest test yet. Be part of our journey and let's navigate the unknown, uncover the untold, and safeguard our future together. Tune into your public broadcaster, for it is the intersection of trust and truth. Because to UBC, your story, and every voice matters. UBC, inspiring Uganda.
When you want to relax your body and refresh your mind, welcome to Hotel La Confidential, Aroa's premier destination for luxury and comfort. The only hotel in Aroa City offering a serene atmosphere, breathtaking scenery. Come and discover our exclusive wellness club with packages that include a fully equipped gym, a rejuvenating sauna, steam bath, and a great sky blue swimming pool. For events, our state-of-art conference halls and versatile event spaces are perfect for hosting shows, wedding receptions, birthdays, and more. Come and enjoy our cinema hall and unisex saloon, all designed to meet your entertainment and grooming needs. Bring your family and let your kids splash around in our beautiful kids water park. We are located on Aroa Pakwachi Highway in the heart of Aroa City. Don't wait. Visit us on www.hotellaconfidential.com or call us on 0761 688 181.
Welcome to Kiruddu National Referral Hospital, and this is our ICU. Our ICU was developed and started in 2021 in response to the COVID-19 epidemic, and we started originally with 3 beds. We started as a 3-bed ICU, but as we could not fulfill the needs for the entire hospital and for the country, the ICU was expanded to accommodate approximately 9 beds. We usually manage patients who have respiratory failure, that's patients who are unable to breathe on their own. We're able to place them on our machines known as the ventilators, and we're able to give them support. We're also able to give critical patients critical care in terms of advanced life support and such. We also receive patients from around the country who have a number of issues such as kidney issues, who we are able to help with dialysis and other support as well. Currently we have a capacity of 9 beds. We do try to improve, and we do try to build our capacity to have more patients.
A very good morning to you. Thank you for still keeping it on UBC TV. My name is Sophia Matovu. And of course, you might be asking yourself what it is about this morning, but we have a special edition for you today on our Q&A. And we are going to talk about a very, very interesting topic, but your health is your say, like I normally tell people. Now, for some people, when you talk about Kiruddu Hospital, it is a place surrounded by fear, questions, and unanswered stories, while for others, it's a lifesaver. You cannot tell them or refer them anywhere else apart from Kiruddu Hospital. But beyond the gates, inside the wards and the corridors, doctors are working long hours tirelessly to ensure that you get all the necessary care, to ensure that they're able to save a life. And a lot of resources are being put into this. But I normally tell people I'm not the expert when it comes to some of these things. Now, our topic of discussion this morning is Kiruddu Hospital, where care continues against all odds. I am privileged this morning to have with me in studio Dr. Charles Kabugo, who is a senior consultant physician and the director of Kiruddu Hospital. Good morning, doctor.
Good morning, viewers.
Okay.
Thank you for hosting me.
And thank you too for taking time off. By the way, today is diabetic clinic at Kiruddu Hospital, and doctor had to take time to come down here to the studios specifically to have this discussion. Thank you so much for sparing time off. But I know you've left everything in proper hands.
Yes, everything is moving on well.
Okay. Now, doctor, I'd like us to start by, when we talk about the different national referral hospitals, when you get to talk about Kawempe Hospital, everybody clearly, even the layman, knows what exactly it does. That is what they'll tell you. Now, then we have the specialized women's hospital. They will also know that is in Molago. that is for the women, antenatal, you know, and all that. What exactly does Kiruddu Hospital do that Mulago National Referral Hospital does not do?
Thank you very much for hosting me. Yes, that's a very important question. The way the health system is structured in Uganda is that if you start from the top, we have the National Referral Super Specialized Centers, where we have the Uganda Cancer Institute, we have the Heart Institute, and then the Mulago Super Specialized Hospital. Those are the top tier institutions that provide care. And then below them, at the general, we have the National Referral Hospitals. National Referral Hospitals include hospitals like us, Kiruddu, Kawempe, Butabika, Women's Hospital. Those are considered as National Referral Hospitals. What do? They receive patients from the lower level health units that have failed to attend to these unique cases, and then they refer them to us, and then if we also fail, we refer them to the super specialized facilities. So that's the way it is structured. Now, what is different from us and other places? Yes, if you looked at the services that are in Kiruddu and versus the services that are in Kawempe, when Mulago was undergoing renovation, Ministry of Health, through its wisdom, decided that we are going to, because of space constraints and all the other things, and also ability to build competence, we allow these hospitals to eventually do unique services. So women went to Kawempe, as you have rightly mentioned. Then the other service areas like burns and plastic surgery, and then another subspecialty called internal medicine. Internal medicine is a subspecialty that deals with diseases that affect all organs in the body. The heart, the kidneys, the intestines, the lungs, the brain. Each of those organs is a subspecialty in medicine. Now, the adults fall under internal medicine. The children fall under pediatrics. So we at Kiruddu do the internal medicine. So we see the adults that have got those diseases that have affected those organs. Mm-hmm. Yes.
Okay. Okay, now we have a WhatsApp line displayed, by the way. This conversation is also for you to participate in. That's why we say your health, your say. Much as it's a Q&A, you definitely will be in a position to drop in your question, your contribution towards the show, because you are supposed to actively participate. Apart from those, because it's quite amazing to see how you've done the proper breakdown, have you had, there are certain scenarios where some people will think, since it's the closest, I live on Salama Road, I should rush with my condition to Kiruddu. How do you manage? Do you also refer them, or do you deal with them based on what state they have come in?
Yes. When we receive these patients, they eventually, even if they don't fall within our docket, let's say a mother from within Salama area comes to us, and we realize this is a mother that is supposed to be in Kawempe. Once you enter our gates, you are our responsibility. So we have a standby ambulance that eventually delivers you to Kawempe, accompanied by a nurse and a doctor. Mm-hmm. So once you enter our gates, you are our responsibility. Mm. But before I get into there, I also want to emphasize that, one, Kiruddu Hospital, I wanted to give some background on how it started. Mm. Like I said, during the renovation of Mulago Hospital, when we moved to Kiruddu, and Kawempe also moved in, these were initially small units that were just doing routine immunizations, HIV testing and things like that. So when we moved into these buildings after the ADB project, ADB was the African Development Bank project, for which government of Uganda, we must be grateful, injected money to construct, upgrade these hospitals. We were mandated to provide services in certain disciplines. And as Kiruddu, like I mentioned, we were told to care for services in internal medicine, for the organs I've told you, diabetes, hypertension, and all the other diseases, and also burns and plastic surgery. But in addition to that, clinical services, we also do teaching. Kiruddu Hospital is a teaching hospital. So we do teaching for Makerere, we do teaching for all other universities around. So they come to us for the students to get exposed to the unique care that we offer. We also do research. So these are the three thematic areas that we as Kiruddu are mandated to be doing. So regarding the referral pathway, yes, when a patient comes to us and does not fall within the area that we're supposed to be handling, we eventually, like I said, handle them, resuscitate them, stabilize them, and eventually deliver them to where they're supposed to be. In addition to the services that I've mentioned with burns and plastic surgery, we have now also started expanded in certain areas that initially we were not supposed to be covering, but because the demand in the area is overwhelming, and then the demand also from the other centers that we are referring to, they have been overwhelmed. So we've decided to open up more space to take on more services. And which are these? We are doing like general surgery. Where have we taken on general surgeries? Because Kiruddu Hospital is located on Salama Road. I'm sure you know the place.
Yes, I do.
Our road has just been upgraded, but we are near the expressway, Munyonyo Kajansi Expressway. So we realize that many of the accidents that happen on that road are eventually delivered to Kiruddu. So we have been eventually forced to upgrade our general surgery services so that we cater for these many cases that we are seeing. So when you look at the statistics of the cases that we've handled in the last couple of months, definitely are enormous. These are real accident cases. Some of them are injuries from various reasons, for which when you think of taking them to Mulago, by the time they reach Mulago, either they will be dead or their outcomes will be compromised. So we've decided to handle some of these cases on site at Kiruddu. So we've built capacity in that area to say that we deliver that particular service as well.
Then what about, do you have a scenario, because given the different specialties and the way you have broken them down, where Mulago General Hospital will refer, the national will refer instead a patient to you, as opposed to them dealing with that particular patient? Does that happen?
Yes, because we're trying to encourage patients to avoid walking in a super specialized facility like Mulago. Like I said, Mulago should be receiving cases from us. So a couple of times we've seen situations where Mulago has received a certain patient, but then has realized that this patient, from their own assessment, they realize this patient can be ably handled in Kiruddu. So then they eventually first said, okay, yes, you have come here, but we think this case can be handled in Kiruddu. Please go to Kiruddu Hospital. In case they fail, then they will eventually refer you here. So we have seen that situation where patients have initially gone to Mulago, being assessed, stabilized, then sent back to us. So that situation arises. We then also have situations where certain services are only available to us at our site. I want to give an example, like the burns and plastic surgery unit. We have the biggest burns and plastic surgery unit in the country. Recently, I think I'll quote the most recent situation where we had the Chigogwa fire, where a petrol truck rolled and people were siphoning fuel, and we had many casualties from that. We received about 45 patients from that fire. Many of them initially had reported to Mulago, but these were cases that were supposed to be handled in Kiruddu. So Mulago would stabilize and then refer to us. They would stabilize and then refer to us. So many of these cases that came from that fire were treated in Kiruddu. So that is one of the situations where a service is uniquely available to us, so that even if you went to Mulago, they will still refer you back to us. Yes.
So I would like for you to help guide, because I remember before Kiruddu became what it is, people knew it that maybe on such and such a day, there is the thyroid clinic in Mulago, there is the, diabetes clinic in Mulago, there is this in Mulago. Each day was specifically themed to a specific, condition, I would say. So what is your chart like? Which clinic is available on which day for the general public to be able to understand. So they are able to know if they need the service is available, or all the experts are available on this particular day.
Okay. Yes, we have built capacity to make sure that our specialists attend to patients in an organized manner. So we attach different specialties on different days so that the different specialists of those days in those disciplines are available for you to be attended to. We have in the hierarchy of medicine where when you study the first degree, you are a general doctor. When you subspecialize, you specialize, you become a specialist. And then you continue subspecializing. The beauty about it is that the more you subspecialize, you get more skills in a certain area. So we allow people to specialize in certain areas and they see those cases, which is good because eventually it improves outcome. So those specialists are assigned specific days on which they can see their patients. Like on Monday, we have the hypertension clinic day. Hypertension, I'm sure you know it, is a disease that where your blood pressure is well above the normal. When you come on a Monday, our specialists will be there waiting for you to be seen. And the pharmacy is also stocked with medicines on that day with specific emphasis to hypertension. On Tuesday, we have the renal clinic. Renal clinic is the kidney. The kidney is such an important organ in the body that we don't see it, but it's inside the body. It filters our blood and removes all the toxins and all the other things. So on Tuesday is when we run our renal clinic day. But also on Tuesday we do the pulmonology, that's diseases to do with the lungs. The specialists also will be there waiting for you. In a particular place, we call it the medical outpatient specialist clinic day. We also have on that day, we call the surgical outpatient clinic day. So where people can come and consult. If you have hernias, if you have stomach pain that needs surgical intervention, you can come and see the surgeon on that day. On Wednesday, which is today, we call it one of the busiest days in the clinic, in the hospital, because it runs the diabetes clinic day. The diabetes clinic day is the busiest clinic we have in the hospital. We receive between 250 patients to 300 patients on that day. So the endocrinologists, as we call them, the doctors that treat diabetes, are available to attend to you on that day. But on the same day, we also have doctors that attend to diseases of the intestines. If you have any problem with your liver, if you have any problem with your intestines, if you have problems with ulcers, I've seen many people moving around and taking a lot of tests for ulcers. On Wednesday, our specialists are there waiting for you to attend to you. On Thursday is when we have our hematology clinic. Hematology is to do with blood. So you realize that most of our patients who have got sickle cells are attended to on that day. So I see people buying this, the drug that we use for sickle cell, they're buying it on the open market expensively, yet it is available in the government facilities for free. Whoa. So please come and attend the clinic because the specialists are there to see you. On Friday, we call it the infectious clinic day. That's where we see diseases that are caused by organisms. So that's why we call it infectious clinic. So we have the HIV clinic and all the other infections on that day. So, but of note is that these days I'm mentioning are for patients that are stable. If you have an emergency, our emergency is open 24 hours a day, Monday to Monday. So you don't have to wait. If you have an emergency, if your blood pressure is 200 over something, you don't say, oh, you see, they told me to appear on Monday. No, that is an emergency. You have to immediately go and attend. Okay, so our emergency clinic is available. Also of caution is, please avoid postponing. I've seen people giving their diseases names. If you're uncertain of what your problem is, please come. We have what we call a general clinic. This hospital is structured in a way that if your disease has been diagnosed already, you go in a certain area. If your disease has not yet been classified and you're reporting for the first time, you go in a certain area, and the doctors first investigate you, and they attach a diagnosis to your disease. Then they will tell you, okay, you see, this is what you're suffering from, and for you to continue seeing our specialist on these days, you're going to come on a Monday because you have hypertension. You have diabetes, you're going to be coming on Wednesday because you have diabetes. But I've seen patients come and they have already made their diagnosis. I have ulcers. I'm looking for the ulcer clinic day. No, leave that to the doctor to eventually make that diagnosis. So those are some of the services we offer. I want to still emphasize that, please, if it's an emergency, don't wait. Because an emergency, if you're vomiting blood and you think it's ulcers that are making you vomit blood, don't say, oh, but they said the clinic was on Wednesday, let me wait for Wednesday. Because you're losing blood. That's an emergency. Our emergency is open day and night. And it has specialists who are there to attend to you. So please come. When you report early, we definitely have a better outcome. Okay? So those are the days. This is how we are structured.
Now then, there is a perception where some people will feel, how should I say, they say they are not comfortable and they're like, maybe it could be in the category of emergencies, I'm not sure, but then they'll say, when I went there, the doctor for my condition wasn't there. Can't they be helped around that time? Because assuming it's not an emergency. And they say, I was told the doctor maybe is probably in another referral hospital, or is at another duty station, or this, the other. How far true is that?
Yes, thank you for bringing that out. Yes, like I said, it's a perception. At any one time when you report to hospital, there's a doctor to attend to you.
Very true.
Unless it is your choice not to be attended to by Dr. X. Because I've seen people who come and they say, I have come to hospital, I've come to see Dr. Kabuga. But Dr. Kabuga is not going to be available 24/7. Because on that day, the doctor you want to see might be in theater, might be attending something urgent. So, but that doesn't mean that because that particular doctor is not available, you're not going to access care. We usually have a lot of other standby doctors that are equally competent that can be able to attend to you. But I have seen many people come and say, you know, my doctor is not there, so I've gone back. Yet there are other doctors who are able to see you, attend to you, and give you the service that you need. I think it's all about patience. Sometimes as patients, we attach and say, this is the only person who can cure my disease. But I would strongly advise our patients and our users of the hospitals that when you get there and your doctor is not available, please see the available doctor, because whoever is working in the hospital has already been selected by government and is competent enough to attend to you. It's different from, let's say, a private facility where they may be employing a very junior doctor. Here we have competent teams that should be able to attend to you. In case you come to me and I think I'm not strong enough, your case is more complicated, there's always a colleague nearby that I can consult so that I eventually give you the care that you deserve. So it's not true that you may get to a facility and the doctor cannot attend to you. No, unless it is your choice.
Then you did mention about the diabetics clinic. The number is quite alarming. When you said 300, I'm like still trying to take it in. That's a huge number. Is that from Kampala alone within, in terms of the patients?
Some are from Kampala, but we've noted that the majority of them are coming from up-country stations. And that gets back to the problem that I told you about, how patients eventually get attached to a doctor, because they could have referred you to us in the first place 2 years ago with an unknown diagnosis. And then I helped you make a diagnosis, and then you got better. And from that day on, you feel like no one else should care for you.
But only you.
But only me. So
they personalize you.
Yes. So you find patients now traveling all the way from Jinja, from Bali, from Arua, from Kabale. They come and they want to still continue seeing me or seeing the doctor they saw that time who sorted their problem. And yet on the referral, we usually summarize whatever we've done and say, please go and attend your nearest hospital. We have written to them and told them what exactly you're suffering from and the medicine that you need to take. So we are working effortlessly to make sure that the referral system is streamlined so that patients are able to access care from their nearest facilities. It is now known that the government of Uganda has put in a lot of money in bringing care nearest to you. I think all of us are witnesses that somehow in our villages or in our areas where we stay, there is a nearby functional government facility that we can visit. But I think people are still stuck in the old mode where they thought that those hospitals were not functional. So they still want to continue coming to Kampala. Either they have a relative in Kampala or they feel their doctor is in Kampala, the only one who can attend to their illness. But I strongly appeal to members that all these hospitals, a lot of investment has been put. Recently, like all regional referral hospitals have got CT scans installed, ultrasound scan, specialists are posted there. No regional referral hospital is not well equipped to handle many of these cases. But we're still seeing a lot of cases flocking Kiruddu, a lot of cases flocking Mulago and other Kampala centers. So you get eventual crowding. Unfortunately, that eventually, when you get to very huge numbers, the doctors eventually get overwhelmed. And then you find the doctor who is in the other hospital that you left behind is free.
True.
You see? So we definitely appeal to the community and users of facilities. Please visit that nearest facility. The perception you had before that they are not functional is no longer true. Many of them have been upgraded. Many health center floors have been upgraded to hospitals. They are now very functional. Yes.
Okay. Now, before we respond to the general public's participation and their questions or concerns, I would like us to help to demystify the death spot narrative. Now, is it true that Kiruddu Hospital only receives the most critical cases? That's what the public thinks.
That is a very good question. Yes, it's partly right. One, I want to make it clear that we never visit hospitals when we are normal.
True.
We visit hospitals to repair our health.
True.
Two, sometimes the illnesses that bring us to hospitals, some of them are incurable. Some of them might be cancers and all the other things. So some of them may not be able to be cured. Three, by the time you get referred to Kiruddu from a lower level health facility, it means the case at hand, the disease that you have, is definitely complicated. Because if it was a simple malaria, they would treat it in the small health center where you came from. So by the time you get referred from my village in Komansimbi, then you come, you get to Masaka, and then Masaka says we can't handle you, then go to Kiruddu. It means the disease you have is very complicated. So we definitely try as much as possible to see that we do to the best of our ability, but sometimes the best of our ability may not be able to cure the illness. Where we have succeeded, that's good, and we have a lot of success stories where patients have been referred to us and they've been cured. But there are situations where sometimes because of the state of the patient, that the outcome may not be favorable. And what sometimes causes an unfavorable outcome? One, the disease itself. Like I said, you might have a disease which is incurable. Some cancers are now treatable, but some are not yet. So the type of disease that you have influences your outcome. Number two, you may have a simple, what I would say, a simple ailment like malaria, but the state at which you have reported to hospital, you have come at a time when you now have complicated malaria. It's no longer simple malaria. So the state at which you report, and that's where we appeal to the people, avoid self-medication.
True.
Patients have come to us with treatable diseases. I want to give you an example. Some of the things that cause death in our hospitals all over Uganda are things like TB. By the time you get symptoms, by the time you get severe illness, you have coughed more maybe for about 3-4 months. You've had fevers for 3 or 4 months. You've been unwell for 3 or 4 months. Then you wonder, where has this individual been for the last 4 months?
They will only wait to come when they start coughing blood.
Exactly. Now you've mentioned it. By the time you start coughing blood, that's when you realize, oh, this illness is now serious. I think I should now go to hospital. For sure, by the time you come to Kiruddu and you're at the stage of coughing blood, that is late reporting. And we have appealed to people, please, why do you want to say, oh, this cough is disturbing me? I mean, we say, if you cough more than 2 weeks, please see the doctor. If you have fevers that last for more than this period, please see the doctor. But someone comes to you and says, I've been coughing, I've had fever for the last 4 months. Which hospital have you visited? None.
I've been using herbs.
But facilities have been put at virtually every level. Even health center folds have been given facilities to test for some of these illnesses, for malaria, for TB. All of them have got x-rays. Why have you waited to report this late? So there are a number of factors, but for me those are the 2 factors: that late reporting, when a simple ailment has become complicated, but also the other thing that has a bad outcome is sometimes is a disease itself, which may not have a curable option. So those are things that eventually lead to a bad outcome. But as a hospital, there is no way that you say that I came to Kiruddu and the doctor didn't attend to me, that I didn't find a doctor. We have taken away that narrative. I have friends of mine who have come and said, by the way, they have referred us to Kiruddu. Can you please connect us to a certain doctor? I said, no, you get to emergency. If you get to emergency and in the next 10 minutes you have not been attended to, please call back. And many of them have called back to say, oh, sorry, you're very right. I got to emergency, the doctors were there, I was received and have been treated. And I'm receiving the care that I need. So there's this narrative that people keep running around when they have never even come to really assist. They say, I have heard about this attitude. Let me go and test and see whether when I get to the emergency, indeed, no one will attend to me. No. We know that on a 24-hourly basis, the doctors will be there. Like I told you today, there are 300 diabetics who have come to Kiruddu to get care. None of them is going to walk away without being attended to. We never close the registration and say, you see, at 11, we have now closed, we are only going to treat these ones. No, when the numbers get big, we try to mobilize more health workers to make sure that whoever has stepped into the compound is attended to. So that is a very wrong perception that people still carry about public facilities. And unfortunately, I have seen people who say, oh, you see, I don't want to go to this hospital because it doesn't do good service. But eventually, when things go wrong, they eventually end up there. And I say, I wish you had come earlier. One of the things that we're trying to fight is please avoid late reporting. Any disease, if handled early, will definitely give you a good outcome. Any disease, when you come to me when it has got complications, I want to give you like diabetes. Diabetes starts very simple. Thirst, urinating very many times, unexplained weakness,
loss of weight.
Some of them gain weight, but loss of weight. And any other non-specific symptoms. Those ones, when you come and we catch early, these ones we can reverse. But we have seen people who have come to us when they have a rotten foot. They are at a point of amputation. That's when your diabetes is diagnosed. That means you've had it for a number of years, untreated or poorly treated. Now you are at the point of getting an amputation. Now that is complicated disease. Okay? That is complicated disease. Someone would have benefited from a few, 1, 2, 3, 4 tablets and lead a normal life. Now you're going to use a limb. If you have been a farmer, you now can't farm.
And some of them, you're not willing to get your leg amputated.
And some of them, eventually the infection spreads, and then it leads to a bad outcome. So what begins as simple diabetes of thirst and weight loss and general weakness can eventually end up in something more complicated. Diabetes is a multi-systemic disease. It can cause blindness. people have come and their complaint is blindness. In the course of their treatment, they are found to be diabetic. And the first time, really. And there's no way that you got diabetes yesterday and now you're blind today. No, it means that you've had those diabetes symptoms for long and you've ignored them. And the most painful bit of it is that we see a number of people where it's not like they're being diagnosed for the first time. They have come before, 1-2 years ago, the diagnosis was made, and they decided to go herbal.
True.
They decided to go herbal. True. They decided to go for prayers alone. They decided to go and do all sorts of other things. True. Unfortunately, that can cause a lot of complications. Eventually, when the disease is serious, they have got kidney failure, they have got blindness, they are going to be amputated, they eventually report to the hospitals. So my appeal to members and to the public, please come early. Even if you don't come to Kiruddu, we advise that go and seek for care. Screen. I'll be mentioning some of the things when I'm concluding. What my key message that I'm really appealing to the public to do really.
Okay. Now we have the public, as soon as we put up the WhatsApp line, trust me, I believe I'm seeing quite many questions coming in. Now this is somebody saying, thank you so much for the show. This is Raymond from Luwero. And he has a question for you. I have a friend who turned hepatitis B positive in April 2024 and told him that they told him the viral load is low. How can he really be helped to be negative? Some of them you will find will be in that direction. Another one says, I thank you for the service you're rendering to the nation. It's my humble request to have a gazetted place for the mentally health disturbed people to maintain hygiene of the ward. I also instill some cameras at the entrance gate. This is someone asking. And there's a lot of dirty behaviors going on by the Askaris. This is where he said, in which hospital is this? This is a person who is raising their concern, but I don't think that is within your area. Thank you so much for the great work you're carrying out at Kiruddu. ECG, echo, and Doppler scan services are perfectly handled at Kiruddu. Great appreciation go to Dr. Baluku, is it Johnson, a physician who has been attending to me. So you can clearly see that I would like to know about your dental clinics and the charges. This is someone who is also asking. Maybe before I go into the other rest, because there are quite many questions flowing in. Somebody's asking again, you would like, I'm sure you might have joined in a little bit later, but they're asking, is it a government or a private hospital? My name is Brenda. My back has been damaged by injections. Can this be corrected at Kiruddu Hospital by a plastic surgeon? Maybe, maybe I should allow you to first respond to a few of those before we go into the other questions that are being raised or concerns by the viewers.
Well, thank you very much, viewers. I'm glad that we're not talking to ourselves, that some people are there out there watching. It gives me a lot of happiness to see that you are participating in our discussion, because the purpose of us to come here is really to educate the public so that they get a way of improving their health services.
True.
Hepatitis B, sorry about that. We have a fully fledged hepatitis B clinic in Kiruddu. It runs every Wednesday. As I speak today, the hepatitis B specialist is seeing patients. Yes, there's a threshold as to when they say we're going to start treatment, because the drugs that we use for hepatitis B are quite strong. They're quite, so don't just give them. So there's a criteria they use to either start you on treatment or not start you on treatment. But please follow the instructions that have been given to you by the doctor. Hepatitis B looks silent, but it is one of the causes for, it predisposes you to getting cancer of the liver. Okay? So that's why we strongly encourage people now to get immunized against hepatitis B. And if you have got the infection of hepatitis B, we strongly encourage people to come and get treatment and get followed up. So I'm glad someone has raised that. If you are not attending Kiruddu, please come and attend. Our clinic runs every Wednesday, and it's run by a very respected hepatologist, who right now as I speak, I left him seated in the clinic. He'll be able to talk to you. He'll give you all the time that you need to answer many of the questions and stick to that. The problem with the people who get hepatitis B, once they're told that you have hepatitis, they now start taking herbals. Unfortunately, everything that we eat, including food, is handled by the liver. So if you get hepatitis, it means your liver is sick. So if you start now taking herbs that are not selected, that are not approved, it means you are now subjecting your liver to more damage. It already has a virus, you are now subjecting it to more damage. So you are going to accelerate damage. That small bag you see there causes a lot of problems. Some of these symptoms, by the way you see there, may not come
at the start.
At the start. That fever, yellow eyes, dark urine, they may be so subtle, or they come and they go. But that doesn't mean that the virus has gone. It has long-term complications. One of them is definitely cancer of the liver. So I'm glad that our client has called in. Please come on Wednesday and come and see the doctor. Mental health, yes, at Kiruddu, we occasionally get patients who come in with a mental illness. Some of these have got mental illness with other illness. So they can't be admitted in Butabika because we have to first handle those other illness that they have before we transfer them to Butabika. And as you know, when you have mental illness, your hygiene behavior is very poor. So I understand that one must have been a patient who has been to Kiruddu recently, because we had a patient who was problematic, who would go and use every corner as a toilet. Oh, wow. So I think that's why he has raised that question. Unfortunately, we could not transfer him to Butabika immediately because he had another problem that we at Kiruddu were still sorting. But now we've sorted that out. He has already been transferred. Yes, he suggested that we get a corner where we can put them. I'm sure he must have seen that one of the biggest challenges we have in Kiruddu is space. We are definitely constrained with space, but I'm glad that government of Uganda has stepped in. They are going to buy for us more land for expansion. The other one was an appreciation. I'm very glad that you've recognized Dr. Baluku and other team members that are always there. And that's what I mentioned previously, that you're unlikely to come to Kiruddu to get a service and say, I have not been seen. No. Because there will be someone to attend to you. We have a dental clinic. It runs every day. Please come and utilize the services. We may not be able to provide a full range of all the dental services because some dental services are high-end. You know, dental services is not about extracting the tooth. Nowadays, technology has changed. There's a lot of dental tooth preservation. We don't want people to have their teeth removed. They try as much as possible to keep it inside. So some technologies we have not yet been able to get, but we have definitely progressed a lot in acquiring equipment that can be able to help with the dental services. So let him come, open 24 hours, open every day, Monday to Friday. Let him come, he will be able to get of that. Kiruddu is a government facility. So 95% of the patients that come to us get free services. But government of Uganda has got a policy that within its public facilities, you can establish a small private corner so that if someone comes and they don't want to get in the general queue, they can go and be seen by a doctor after being paid a small fee. And there are also some small services where we say contribute a small fee to that. I want to give you an example. At Kiruddu, we do dialysis. Dialysis is a special service where someone has got chronic kidney disease. Your kidneys are damaged for various reasons, and they cannot no longer function and keep you alive. If when both of your kidneys have gone, you meet your maker if you don't have dialysis. Or you have. So many of these, so some of, we offer dialysis services in Kiruddu on a daily basis. We do about 60 sessions every day, and we ask patients to pay a small fee of 60,000. But the consumables that go into that service are worth about 380. So the bigger burden of the cost of care is by government.
By the government, yeah.
Okay? So we charge them and say, please pay 60,000. But I want to tell you that even the 60,000 we ask patients to pay, I think 80% of them can't afford it. So you end up, people come and access the service and then promise to bring the money later. But many of them are not able to pay for it. So if some find someone accumulating a bill, but what do? Do you stop them from accessing care? No, because our mandate is to keep Ugandans alive and continue working so that eventually they contribute to the economy of the country. Yes, collecting money may be a component when we run a private service, but the key thing we want to do is to keep Ugandans healthy. Because when you're healthy, then you participate in generating income. When you generate income, then you pay taxes. When you pay taxes, you build the economy. You build the country. So that is, for us, the way we look at it, that we cannot deny you a service because you have failed to pay.
Yeah, true. That's good.
Yeah. So it is a government facility. Yes, but some services you may be asked to contribute. But in the event that you cannot contribute, there is a special provision for you to access that service.
Okay, that's good. Now, this is Good Morning. I'm Tessie from Arua, and there's a concern being raised, but much as it's in line with Arua Hospital, I believe you'll be able to help them understand. Arua Hospital is too expensive. Before you go for operation, you have to pay 250,000 shillings to the doctor before him touching you. But some people from the village cannot afford that amount of money. Please, what can we do? Then, good morning at UBC. Thanks for the program. I would like to know from doctor if truly medication from government hospitals is completely free of charge. Because I had some encounters within Naguru where I had to pay for medication. One instance was at the section of physiotherapy, and second happened at X-ray room, and the last one happened at the labor ward. Then this is a person calling, okay, all the way from Barara. Thanks for the program. My question, when I need a job, this one is asking for a job. Okay, doctor, I will be able to respond to you. This is Jovia from Nansana. I appreciate your services, both emergency and normal. That is at Kiruddu. Then this one is inquiring about endoscopy. He didn't say where he was inquiring from. And then this is Hussein from Luzira. My wife has cough that has never gone for a while. What could be the problem even after treatment? Well, there are still many messages flowing in, but let's first respond to those.
Okay, thank you very much again, dear viewers. About the operation issue in Arua, I would advise that you go and see the administration in Arua Hospital and raise this concern. Government hospitals, like all other institutions, are not free of people who extort. So this is a vice that we need to eventually continuously fight. So if someone asks for money, either that there should be a chart to display to show that this operation that you want to get, this is the cost, and then you go and pay for it and get a receipt. When someone asks for money in a government facilities and it's a corridor payment, it's difficult. Please don't accept. We have had instances like this, and at Kiruddu we put numbers displayed all over the place. If anyone asks you for money, which is not in an official area, please call these numbers. So the emergency numbers to call. And then the services where we, like I told you, where there's a user fee to be paid, they are displayed. You go and check on the board and see, oh, I'm going to get an X-ray, I need to pay 2,000. The beauty about it is that when the fee is there, in a government facility, it is severely compromised. It's severely reduced compared to what the actual cost would be. I want to give an example. Like if many government facilities, if you're going to get, let's say, an ultrasound not for pregnant women, for other things, in a government facility, you may find it's about 10,000. If you went to a private facility, they will charge you 50,000, 100,000. So, for that particular case, I'm not going to talk about the Arua because I am not the administrator in Arua, but I would advise that that individual visits the administration in Arua and the case gets addressed. You'd be very surprised that it's a cornerman putting on a clinical coat, walking in the corridor. Yeah. We have arrested many of them in hospitals. They usually come in the evening and they pose as doctors. The next issue was, is medicine free? Yes. At least I can talk for Kiruddu. That right now, as we speak, the reason we have about 300 diabetics pouring in Kiruddu right now is because someone knows that out of the 4 medicines they are going to write for me, either I'm going to get all of them or I'm going to get 3 out of 4. This is a great improvement from where we used to give 1 out of 5. Now we give 4 out of 5 or 5 out of 5. So it is a great improvement, and we're really very grateful to the government of Uganda for that huge investment in improving availability of medicines in hospitals. The issue of Naguru, of X-ray and physiotherapy, like I said, if there's any fee to be paid, it is by law required that the facility that is charging should display the costs so that whoever is going to use knows what to pay and where to pay. Nowadays, the good thing is that when you're paying, you pay and you get a receipt and the money goes to the consolidated fund immediately. True. Please don't pay when you go into a doctor's consultation room and anyone asks you for money. Please report that person. I have asked people to record videos. And if you don't get redress, like if you come to children and someone asks you for money under the table, you please come to my office. I have an open door policy. You come and you have a complaint, it hasn't been addressed, come. That so and so has asked me for money. And we'll see how to handle it.
Yeah, true.
Yes. Then endoscopy, yes. We have an endoscopy suite in Kiruddu, where we do upper and lower endoscopy. Endoscopy is where they put a tube and they check your stomach, they check your throat, they check your intestines to see if you have cancer. Cancer of the intestines is very common nowadays, and unfortunately, many times it is detected late. We usually encourage people that up to a certain age group, if you are 50 and above, please go and have a routine endoscopy. Depending on the findings, they will tell you how often you need to do it. This helps a lot. If there's anything suspicious, they will intervene. And I've seen people being saved. Findings have been made on just routine testing, and they found the diseases. And the disease is caught early, and you get a total cure. If cancer of the colon is found late, you're unlikely to survive, because by then, by the time it has shows symptoms, it has already spread to other areas. That part of the colon you see is a very long area. You see? So any part can be affected. So the first picture shows the upper GI endoscopy. We give you some small anesthetic, you sleep a bit and they put it down. So you realize it starts from the mouth, it goes to the throat. We have cancers of the throat. I don't know whether you've had cancer of the throat. You've heard people say they found cancer of the throat. The first sign you get when you have cancer of the throat is difficulty in swallowing solid things. You realize the tea goes, but the food doesn't go. Whether you find a patient complain that, I have to crush my food into very small particles for it to go. Those are signs that your throat up there is not okay. Please don't wait for that. Go and have a routine test and so that they see. So from the esophagus, you see the stomach there. Cancer of the stomach is also very common. If they catch your cancer of the stomach early enough, you can get some solution. You have the duodenum, that is the first part of the intestine. That also is an area. So a number of things can be done. But ulcers, People have been treating ulcers. They take medicines. People have taken bottles and bottles of magnesium. People have taken omeprazole. I know people who have taken omeprazole every day as a meal. Yet in actual sense, what they're treating is the wrong disease.
Oh dear.
So at endoscopy, you find something completely different. Because the pain of ulcers can be very similar to pain of cancer. Because they're all wounds in the intestines.
The intestines, yes.
So they will all give you discomfort there. So you may take a bit of omeprazole and get some relief. By the time you say, let me go for endoscopy, it may be too late. So please, I appeal to the public, don't do self-medication. Seek for care so that you get the right treatment. So we have an endoscopy suite in Kiruddu. Please come. If you have not been given a prescription to go and get it, you first see our doctor, and the doctor will determine which test that you need. Like I said, the doctors are always there to assist you. So please come, the doctors will do. The endoscopy suite is functional. Monday to Friday, you come and book because the instructions they have to give you. You don't walk in and get the test immediately, because you have to come when the stomach is empty, or you have to have cleaned your intestines so that they get a good image. So please come and utilize our services. Like I said, government has invested a lot. It hurts me where government has put in a lot of resources, but utilization gets hazy. It is very painful to see people still dying of TB in this modern world. Extremely. The TB drugs are free. The X-ray is free. The lab tests are free. But people are still dying of TB. Why? Because of late presentation. The gentleman who talked about cough is just a sign. It's not a disease. So cough can be a sign warning you of something. Cough is just telling you that there's something not right
in the body.
In the body, especially in your breathing system. Okay, every system has got a way of warning you. When you eat something that the stomach doesn't want, you either vomit or you have diarrhea.
Yeah, true.
Okay, when you get something in the eyes that is not good, it will itch. When you get something in the nose which is not good, you will sneeze. When you get something in your respiratory system that is not good, you will cough, or you have difficulty in breathing. So, cough is just a sign. Please go and visit your doctor so that the doctor is able to say the cough you have is attributable to this. There are people who have got an allergic cough. You've had people who cannot sit in an AC.
Yes, yes.
Once you switch on the AC, they start coughing.
They start coughing.
Okay? So, but that is the job of the doctor to make that diagnosis. We have also known people who are allergic to the environment. Recently, our Lung Institute in Mulago made a research and established that the contamination of the air that we breathe in Kampala is extremely high because of fumes.
Yes, sure.
Fumes from cars, fumes from factories, fumes from the waste that we burn, a lot of things that we are putting in the environment that now symptoms of the chest are just too many. So we advise that if you have got a symptom like that one, a cough, please go and get there are people, the pulmonologists. The Lung Institute is open. We have a pulmonologist in Kiruddu and a lot of other hospitals. Go and they will attach a diagnosis to your symptom of cough.
Okay. I can see the questions are still quite many that are keeping on flowing in, and we'll try to make sure that within the means or the other hour that's left, we'll be able to respond to them. So for that reason, I might even find it hard to take a break, but let's first take this few, then we will be able to take a break. Thanks for the program and your assistance to people. My name is Nakazi. I want to know if you attend to prostate cancers patients and which day. Then there is this one who calls the different. Thanks for the services delivered to us. We appreciate. But I have a question for the doctor. Can you care for some serious hemorrhoids leading to curement. Different levels of hepatitis B was already addressed. And then this one still, the one you told about the hepatitis B. Thank you so much. I can now be helped. He still responded back. Then, hello doctor, I got paralyzed halfway from lower back, waist downwards to both legs since May 2025. I have been using a catheter since May. Can Kiruddu help restore my back? Okay. I have a problem with inside my ribs, but I have gone into various hospitals and no doctor is understanding the fault. We did the x-ray, but there was nothing. The ultrasound scan, nothing, but it pains severely. What could it be? Also ulcers, but nothing. So, doctor, I beg you, because they are still now, wow, quite a number of questions flowing in. If you can respond to those ones quickly, then we can be able to take a very brief break, and then we can be able to respond to the others. Because like we said, your health is your say. And that's the whole reason as to why we have this Q&A, for you to be able to get all the necessary help and information you need from Dr. Kabugo. Doctor, please go ahead.
Thank you once again to the viewers for bringing these very important questions, because these are they appear simple, but they are eventually the key questions that our population is out there struggling with to get answers for. So please, no question is simple. Please send in anything that you want to be addressed. The issue of prostate cancer. If a diagnosis has already been made that you have prostate cancer, then the place to be is Uganda Cancer Institute. So these are unique services that were established by the government of Uganda to have care centralized there. So if you have cancer of the prostate, please visit the Uganda Cancer Institute for definitive care. Hemorrhoids, the other person who said he had hemorrhoids. Hemorrhoids, by the way, can be a sign of bigger things. Hemorrhoid can be just a sign that there's something inside. So please don't just manage the hemorrhoid. Yes, it might be an innocent hemorrhoid, but it can be sort of something inside your intestines to show that you need specialized care. So if the gentleman who has sent this has not sought for proper care, that's why when you have hemorrhoids and they are not going away, they will do what they call a colonoscope. Okay. So they'll look all the way and they see what is the problem. And if it's just a simple hemorrhoid, nowadays they do surgery. And they will do surgery and you'll get a definitive cure. So please, we have a team of surgeons that is always available in Kiruddu. If you have not come, please come and see them. Come and visit our surgical outpatient. I've already given you the day that on surgical outpatient, the surgeons will be there to assist you. The surgical outpatient clinic is on Tuesday. The surgeons are there. Don't come another day, because the surgeons, you know, their life evolves between theater and the clinic. So when you come on a day when they are all in theater, then they may be able to attend to you. But come on a Tuesday, and they will be able to assist you. But like I said, hemorrhoids can be a sign of something more serious than we think. The gentleman with weakness from the waist downwards, we are really sorry about that, but I hope the cause of that has been established. Most of the things that I realize that are being mentioned here are not a disease. They are just a manifestation of disease. And they are not a manifestation of one disease, they're a manifestation of many diseases. So it's difficult to say that because you have weakness from the waist downwards, you have this disease. The doctors need to establish what disease has caused this. And if it is treatable, you will be treated. Yes, we have a neurology clinic. The neurology clinic is today. It runs with the diabetes clinic day. You come and the doctors will be able to come with all the investigations that you've done. Even if you have gone to Mulago, even if Mulago has got a neurology clinic, and then they are able to tell you that this is the disease that caused your paralysis. Paralysis can be caused by many things. Accidents cause paralysis, you see? But even infections, there are viruses that cause weakness. There are cancers that go in the spinal cord and they cause weakness. So there are so many things Weakness in the lower limbs is just a sign that you need that whole vertebra you see up there. Inside there is the spinal cord. The spinal cord is responsible for movement of our limbs. So if it is compressed at any point, once it is compressed, you get weakness from that point downwards. So that's why I'm saying any injury. Right now we see so many border accidents. We've seen so many border accidents. So people have come with broken backs and they've manifested as weakness. So it depends on the cause. Please visit the nearest facility. The key message I think here is please visit a facility. If the lower level thing does not be able to give you a definitive answer, get a referral to the next one. Okay? You may not come to Kiruddu all the way from Kabale, but visit Kabale Hospital, visit Mbara Hospital, visit Masaka, depending on the area. I mean, all these regional referral hospitals are now fully functional, equipped with all different specialists. Okay? So if you can't come to Kiruddu, visit those other facilities. Then the last one was the I don't know, the gentleman or lady who had said has pain in the ribs. I don't know whether all the ribs or one rib.
Specific rib.
Or is it a result of coughing? You know, there are still so many unknowns. Still the message here is visit a doctor. Visit a doctor, walk away from your, people are still in this mode that this small clinic has treated us from the time we were young people.
Very true.
That clinic at your village treated you for diarrheal diseases and malaria. Now you have outgrown that.
True.
The diseases you're having now are more complicated. So please walk away from there and say, I am now visiting a higher facility. I was saying, oh, it's that place, we know, since we're young, that was our doctor. Since we're young, yes, he treated you for malaria, he treated you for diarrheal diseases, he treated you for small chest infections, cough and flu.
Exactly.
Now, what you're describing here is way beyond his capacity. He doesn't have the diagnostic capacity to really investigate this. Some of them are run by people who are not updating themselves with advances in science. Exactly. Science is a very rapidly changing area. So you have to definitely, I've seen people being told lies in the villages there. But they keep going and they give you a thing which you hold in the hand, which diagnoses all diseases. And they charge you a very modest fee, I think of 50,000. Then they give you a very big printout, members. And if there's anything that you not get out of here, those are quacks. They come with their printouts. They come and tell you, hold this gadget here in your hand and we're going to diagnose all diseases. There is no one single machine that diagnoses all illnesses. Never. Science has never discovered that. So, and they usually go in the villages or in the markets and they deceive people. And they give them printouts. People have come to me and they said, you see, I went to the computer and they did this. And they have a whole 5 pages of a printout which...
with small dots in it.
Yes, with very small dots. The liver is sick, the kidney. Usually the constant is the liver, the kidney, the intestines, the heart. All those are usually sick. You have poor saturation. They talk about and they usually use scientific terms like viscosity. Those are quacks. Please avoid those people because those are some of the reasons why our patients are reporting late to the facilities.
True.
So please avoid, come early and seek for care. I don't know why people like quick fixes. Come in the line. Yes, I have nothing. I mean, if you come and there are 10 people ahead of you, just be patient.
Yeah, true.
The doctor will see you. But at least you walk away with a diagnosis. Okay? I think that is it. Okay,
at this particular point, I'd like us to take a very short break for like 2 minutes. Then doctor will still be in a position to answer and respond to your questions. I can see there's still very many flowing in, but right after this short break.
Welcome to Kiruddu National Referral Hospital, and this is our ICU. Our ICU was developed and started in 2021 in response to the COVID-19 epidemic, and we started originally with 3 beds. We started as a 3-bed ICU, But as we could not fulfill the needs for the entire hospital and for the country, the ICU was expanded to accommodate approximately 9 beds. We usually manage patients who have respiratory failure. That's patients who are unable to breathe on their own. We're able to place them on our machines known as the ventilators, and we're able to give them support. We're also able to give critical patients critical care in terms of advanced life support and such. We also receive patients from around the country who have a number of issues such as kidney issues, who we are able to help with dialysis and other support as well. Currently we have a capacity of 9 beds. We do try to improve, and we do try to build our capacity to have more patients.
Tarehe Sita is celebrated in Uganda to commemorate the start of the National Resistance Army's liberation struggle on 6th February 1981, an attack on Kabamba Barracks, leading to the NRM's rise to power in 1986 and the formation of the Uganda People's Defense Forces. The day symbolizes the foundation of the People's Army, national unity, and the ongoing commitment to peace, security, and socio-economic transformation. On Friday, 6th February 2026, the 45th Tarehe Sita anniversary will be celebrated under the theme Defending the Gains of the Revolution and Honoring the Sacrifices of the Freedom Fighters, a call for national unity, peace, and socio-economic transformation. The celebrations will take place at the National Teachers College grounds in Kabale Municipality. The activities will be relayed live on UBC TV.
Welcome to Kiruddu National Referral Hospital, and this is our ICU. Our ICU was developed and started in 2021 in response to the COVID-19 epidemic, and we started originally with 3 beds. We started as a 3-bed ICU, but as we could not fulfill the needs for the entire hospital and for the country, the ICU was expanded to accommodate approximately 9 beds. We usually manage patients who have respiratory failure. That's patients who are unable to breathe on their own. We're able to place them on our machines known as the ventilators, and we're able to give them support. We're also able to give critical patients critical care in terms of advanced life support and such. We also receive patients from around the country who have a number of issues such as kidney issues, who we are able to help with dialysis and other support as well. Currently we have a capacity of 9 beds. We do try to improve, and we do try to build our capacity to have more patients.
Welcome back from that very short break. But like we said, it's not about me. It's not about what we think we'd like, but we would still like to have you engage fully. That's the reason as to why we have the health Q&A, because we say it's your health, your say. And before we took the break, of course, we were still responding to some of the issues. And here is one who goes, hello, this is Kathy from Kampala. Sophia and doctor, good morning. I am a diabetic patient for over 4 years. I take my medication and insulin, but in the last year, my vision has become very blurry, yet I take my insulin. I've been told metformin is dangerous long-term for the kidneys. Is this true? That is. Then my name is Brenda. My back had been damaged by injections. Can this be corrected at Kiruddu Hospital by a plastic surgeon? Praise God. I am Moses. Thanks so much for the show. I am listening from Chibuli. Yeah, he says from Chibuli. Kiruddu is the best place to be. I had my brother who was in a critical condition, but I wonder, within 5 hours he had started talking. I appreciate the good job done. Truly the service is free, and phone numbers are openly displayed inside the room, that in case anyone asks for any charges, you call. The secret with Kiruddu is to have good coordination with them when they are attending to your patient. If they don't have some kind of medicines, they will request you to purchase. Kindly, once requested, buy. Big up, Team Kiruddu. This is a person really appreciating. Good morning, this is Kathy from Lira. I have seen companies who deal in herbal products go to the main hospital to convince patients to use herbal medicine. How can that be stopped? Because these patients start on herbal products, and by the time they start proper medication, it is too late. I beg we first respond to this, Doctor. Then we'll be able to take on the other batch.
Okay, thank you very much. First, I'd like to thank the people that have appreciated us once again. Thank you for appreciating the service. And at Kiruddu, we strive as much as possible to give you the best of service within our means. We usually request that you give us a feedback. There's a customer feedback channel that has been established where you feel we have fallen short of below of your expectation. You write to us and you rate us, and then we eventually sit as a team on a quarterly basis and usually address some of these challenges. But thank you those who have appreciated so far what we're doing. I will start with the last one because it's very important. The guys who are marketing hubs. At one time, I was one of the most hated people by those herbal salespersons, because they would come and sit in the queue as patients. You see today's diabetes clinic and they come and sit in the line.
Oh.
And while they are there, they never move to the doctor's room, but they are networking with every patient.
Oh dear.
And you know, this, oh, you see this foot here? When you come here, they're going to amputate it. I would advise you to leave this place. Oh, you see, your eyes are not seeing, oh, leave this medicine. So they were extracting patients from the queue and marketing. So we have a circular. Even if you went to Kiruddu, you would see it's displayed. It says, anyone who markets products in the hospital is going to be arrested. So because I interfered with their cash cow, they really hated me because we arrested like 2 and they had to go and get, explain at the police stations. So at Kiruddu, we don't accept that. No one comes to market products because it's very confusing. When you come and market a product within a facility, the clients tend to think that you are an approved product, that since Kiruddu has allowed them to operate in here,
yes,
that means this is an approved product. Yes. So I usually tell them that, you know what, I have no control over your product, but please go and set up a shop outside there.
True. Because
while you are there, I will have no control over you. But within the hospital compound,
no.
That is a no-go area. So if you see anyone marketing products to you, please report them, because that is not acceptable for us. Then the other 2 are the questions where people have got problems. This question is coming back again. He said he got injection. Did they say back, bum?
He said no. He said the back, because I believe when the sciatic nerve is affected, can that affect the back as well? Because he says as a result of the injections. Was it injections in the back where he got a spina during, or she or he during whatever surgery?
Because he's talking about plastic surgeon.
Because he's asking for plastic surgeon.
In the past, when we were young, those of us who are in that age group, they were giving quinine, the bumps, and all of us have got bumps. As a result of the quinine injections. So I don't know whether that lady is talking about those, because she's talking about plastic surgery. So if that is the question, then please come and see the plastic surgeon. But if you're unsure exactly of what is happening, then please come and see a doctor to make a diagnosis for you.
Yes.
But if I know many people get concerned about those quinine injections, because right now those injections were banned, because they would cause limb weakness, they would cause polio-like paralysis. So quinine in the past was a havoc. But it was the drug of choice for malaria. So those of us who are in that age group, we definitely had it rough.
But the IV is still affected?
Yeah, IV is under, yes, it's controlled, but because it also has problems.
Okay.
So if she's listening, please see a doctor and explain in detail, which we may not be able to do now. So, because you're talking back, I'm not sure the back, or bum. And then the other one is the diabetic patient. Sorry about that your vision is deteriorating, and you said your control is very good. Yes, your vision can deteriorate when you have diabetes. And nowadays, there are a lot of interventions that can restore your sight. We have, like today, my ophthalmologists, the eye specialists, are part of the diabetes clinic. We do routine screening of all diabetics to make sure that we detect early changes that are going to cause blindness. So when those changes are detected, effective treatment can be installed. Okay? Nowadays, you've had people getting laser for the eyes to restore. Diabetes can cause cataracts. So you can now cataracts worked on, and then you restore your vision. So many things can be done. And by the way, by the time you get diagnosed of diabetes, your blood sugar has been high for some time. And while it is high for that period of time, it is already causing damage
to a particular.
So you start treatment, and sometimes the damage which was done before you started treatment manifests, and then you think it is the drug which is causing that.
Okay.
No, it is the damage that happened while you were not on treatment. And while you're on treatment, of course, we have targets of control. If it is blood pressure, we know what blood pressure is required. If it is blood sugar, we know what level of blood sugar that is required to be controlled. So please visit, if you are in Kampala, come to our doctors in Kiruddu. They'll be able to check and see what exactly is causing your vision going down. And then she also said that the kidneys are getting damaged. Like I said, early detection of disease is very crucial. For these NCDs especially, NCDs are these non-communicable diseases where diabetes falls. Diabetes, hypertension, and all the others. Diabetes and hypertension are the common ones, but the NCDs are quite many. Many of these, by the time we diagnose them, they have already caused end organ damage. Like hypertension will damage your kidneys. So even when you start treating the hypertension, it goes back to normal. It sometimes has caused irreversible damage to your kidneys. So you have a good blood pressure control now, but unfortunately the damage that was caused before you started treatment cannot be reversed.
Yeah, true.
It cannot be reversed. The same applies with diabetes, that early detection, when it has not caused irreversible damage, is very important. That's why nowadays we encourage people, please go for screening. I know you are normal. I don't know whether here at UBC you do that. I usually encourage organizations to organize days and say, members, the team of doctors is coming. Let's all go there and check our body mass index, check our blood sugar, check our blood pressure, check our cholesterol, check. People are dying young, which is really very sad, that we're losing very productive people. And then we start mourning and mourning and mourning. But you'll see someone eating unhealthy, and you don't want them. I say, have you ever gone for this test? And they haven't gone. So screening and early detection is very important. So that is my appeal, that for all organizations, routinely organize camps, in-house camps, to check your people. Because sometimes, yes, they may have a health insurance, but when they go to health insurance to get care, the other guys may just address what has taken you there.
And it's true.
And they don't address the routine checks because it's not covered under the insurance scheme.
Yeah, true.
Yes.
Okay. Then my name is James. I have gone through endoscopy and confirmed chronic gastritis, but failed to get proper treatment, and is asking if he can come to Kiruddu. Then you have, hello, I'm inquiring about keloids. Are they catered for at Kiruddu Hospital? This is Judith from Lira. But we have private clinic inside the main hospital where they tell you that they don't have the drugs. Rather, you go and buy them from their clinic. Is that also fair? A private clinic inside the main hospital. Oh, okay. Now, Paul, this is Paul. I have a recurring pain in my knee after injury in sports. What kind of service is available in Kiruddu Hospital? Good morning, UBC. Thanks for the program. Does Kiruddu do ACL surgery? I think you should first respond to those before we take on the others.
Okay. I'll start with the one of the private clinic in the hospital. One, we don't have a private clinic within the hospital. And if there's any errant officer who sells you, who has come with these drugs in the pocket and is selling them, that is illegal. You are at liberty to get evidence so that we eventually handle that case. Otherwise, selling drugs, yes, we have a private clinic in the hospital, it is clearly marked. The money collected goes to the consolidated fund. It is not paid to the doctor. If there's any drug that is not within the hospital, you are required to go and buy it from out.
Exactly.
You are given a prescription and you go and buy it from outside the hospital. So anyone selling you drugs does it illegally. And please report. That is my appeal to you, members. Some of these vices, like I said, it's difficult to 100% eradicate them. But it is through your collaborations, through your support, that we're able to bring them to a minimum. Because, like I said, every society will have some of those outliers who still want to do illegal things. So that is the issue of the, otherwise there's no individual who was given a room to run his private clinic.
Yeah, true.
You run a private clinic on behalf of the hospital. Yes. Keloids, yes, we have a plastic surgery unit that handles that. They are open every day. You come so that they look at your keloids and then decide on what approach, what modality of treatment they are going to use. So we have plastic surgery. We have a big team of plastic surgeons in Kiruddu. Please come and visit them. You'll get the service. And it is free. So this other gentleman who has said he has a gastritis, recurrent gastritis, gastritis is really, your stomach is not well. It has wounds. And I have seen many people who that non-healing stomach ulcers is self-imposed. I have seen people who have Panadol every time. I have headache, Panadol. I have this, diclofenac. I have this, you know, for every discomfort, they're taking a painkiller. Painkillers have got their own problems.
Yeah, true.
Even simple painkillers like Panadol, that what we call paracetamol. Nowadays, there's even extra, Panadol extra.
Advance.
Advance. So, please, medicines are not food. That any discomfort, you slept badly, stretch your muscles and the discomfort will go. But I've seen every time people who are just in the habit of self-medication, their bag has a painkiller all the time. I have migraine, painkiller. I have migraine, painkiller. I have fatigue, painkiller. No, fatigue means go and rest. Walk around, stretch. You see? So, some of those painkillers and other herbals that we use just cause worsening. Some people, it is the food. I've seen people where certain foods cause them wounds in the stomach. So please visit your doctor. If you have not visited a doctor and you're in Kampala, please come to Kiruddu, come and see our doctor for the stomach. And he'll definitely be able to assist you and have this sorted. So, someone talked about LCM surgery.
SCL surgery. Asking if you do it at Kiruddu.
Please come and visit and see our surgeons, because we are installing, like as part of our latest equipment, we are, before this month ends, we are importing a machine that does laparoscopic surgery.
Oh.
Okay, laparoscopic surgery does a lot of minimal invasive surgery. It shortens your stay in hospital. This has been procured thanks to government of Uganda, and I think this should be able to help us eventually with the turnaround time, because someone would have stayed for 7 days with a huge incision, eventually now stays for a shorter stay. I think come end of this month, I think or next month we should, the contractor should have installed it and it should be functional. So we have bought in a number of equipment that is already placed. We have other interventions like laser surgery and all the other things that are done for specific procedures. So if you have anything that you think is required, please come and see our team of surgeons and they advise you accordingly.
Okay. Now then this one says, good morning, thanks for the program. This is Stephen from Pade. I just want to ask if all kinds of medicine are free in government hospitals. Good morning, this is Mark from Gulu. Thank you for the program. Whatever the doctor is speaking seems to be, that, okay, for him he thinks you're being theoretical. He's saying that the doctors take advantage of critical conditions in which patients come with to extort money. He says they are con men, as he suggests. They are doctors, but most times it is internet nonsense pursuing diplomas attending to patients. That's what he claims. I witnessed this at Kiruddu. Now it is worse with another hospital. He says like Molago and St. Mary's Hospital Acho in Gulu. They are death rows. It is too much. Okay, that's a serious allegation. Why oral bad health? Yet I brush twice every day. This is Namagembe asking. Then, good morning UBC. My name is Duncan from Tungamo. I want to thank the doctor for the work he is doing. I worked with him under his administrative duties. He's fantastic. I was once a security supervisor of Kiruddu. I'd like you to respond to this.
Okay, I'll start with the one where they are conmen. Like I acknowledged, society has got bad elements. They are everywhere. They're in mosques, they're in churches, they're everywhere. But it's up to you, the user, not to succumb to their bad habits. I'd like to assure you that you can never get, like now, like I said, to have a diabetes clinic. It's not nurses who are seeing the doctors, I mean seeing the patients. There's a whole full team of people who are there seeing patients. But I also want to bring something that I have observed. That happened to me, I keep joking about it. Where we, the patients ourselves, want quick fixes. You've been told to stay in the queue. And you've seen how the queue is moving. Then you start engaging people. Please, can you help me so that I give you something? And I jump the queue. One time I was in the hospital and I was doing my hospital round on a Saturday, putting on my coat and I was moving around. So a patient comes in, says, doctor, I want to check syphilis. I said, sorry, syphilis? Who has the syphilis? I have the syphilis. I think I need to be tested. I also want to be tested for. So I said, okay, but why have you come on a Saturday? Saturday, usually we want, the team that is available is handling emergencies. But if you want to have a thorough screening of all these diseases, please come on Monday. I can assure you, go on this floor, you'll find a doctor who is there, and they will check for all these illnesses. So, but you see, it is only Saturday that I get free time. But now, doctor, suppose I give you something, can't you help me? So you see the prompt comes from
the patient
from
themselves.
the patient. So what are you doing? You're really trying to entice someone to get into a bad practice.
True.
I have given you free information that please come on Monday. You know, out of here I said, okay, how much do you want to give me? I said, I want to give you 5,000. Okay. Eventually, of course, I said, okay. But why am I giving that example? Is that sometimes it is we, the patients, who are supposed to be patient, that are not patient.
Exactly.
You see? Please sit down. We have never sent anyone home in Kiruddu that, you know, we have closed the clinic, we are not going to see you. Once you are in the queue, you are going to be seen. But like I said, it is us who want to jump the queue. I think it is African to want quick fixes.
Exactly.
And sometimes those quick fixes don't yield good results. So that is it. So if you're not careful, you fall prey to conmen. Because now people know, like today, there are many people in the hospital, there are conmen who are dressed very smartly, like patients, and they are there sitting in the queue. If you're gullible, they will definitely take your money. Regarding if the medicine is free, yes. But I have said, I didn't say 100% we do 5 out of 5. But at least we have improved from 1 out of 5
to 4 out of 5.
To 4 out of 5. Why? Nowadays we know that the diseases that affect us have definitely become more complicated.
True.
Like I said, many of the hospitals that were built were for small ailments. Mulago Hospital was started to treat STDs. Gonorrhea, syphilis, that's how Mulago started. Old Mulago, where the clinic started, was for treatment of STDs. But I can tell you now, the if your one was supposed to follow the procurement plan they had when they were establishing Mulago that time, definitely they will not be able to treat any, because the diseases have completely changed. So they require more sophisticated medicine. So there are situations where a certain drug that is unique for your disease is not available. And that's when we request, please go and buy this. But for me, I keep asking people that when you fall ill and someone makes for you the right diagnosis, you have scored already 80% of success. I have seen people procure medicines endlessly for the wrong diagnosis. I have seen people, I don't know whether you've heard about them, that are there treating brucellosis.
Exactly.
That, you see, my doctor told me I have brucellosis, and they have been on injections for 21 days. They are swallowing medicines that are making them more sick. That is a wrong diagnosis, where you're spending a lot of money. People are not valuing the element of the right consultation. That you've come to me and I have given you consultation to give you the right disease. For me, once you get the disease right, you are 80% at the point of solving the problem. So where they tell you to go and buy 1 medicine out of 5 and you get 4 out of 5, be appreciative. Be appreciative, because I know maybe with time we shall be able to have all the medicines, but right now it's not, it will be a deceit that all patients who come to us get all the medicines. But that one medicine that 1 out of 5 that have been given to you, the prescription is given to you to go and buy it from your own pharmacy of choice. You see, when someone says, now you go to a pharmacy,
this particular pharmacy,
then be suspicious. And I keep telling my team that, members, please, when you're directing patients, just tell them, now there are so many pharmacies all over the place. Just tell them, you have a pharmacy somewhere where you stay, please go and buy this drug.
Actually, even many outside Kiruddu Hospital.
Yes, go and buy. Go and buy, so that you... So why should I direct you that, go in a corner, go to Katanga, then you go up the hill, then there's a building, a red no, where do you go through all that pain? You tell them, this is the prescription, go and buy this medicine. When you buy it, you're going to the pharmacy will tell you how it's going to be used. And that is, I think, the way to go. So that, I think, solves the issue of the free medicine. But 100%. You see, I can tell you that if someone comes for surgery, you go to Kawempe, as a mother who is going to deliver, they go to theater, they operate you for free. All the inputs that have gone into that, the anesthesia, the anesthetic gases are expensive, the surgeon that has worked on you, all the other things. Then they say, oh, sorry, as part of this, there's this one tablet that you need to go and buy. I said, you see, now you see, this is too much. But I wish you could cost all these other things that have gone into your care. And then you realize that this 2,000, yes, if it was available, it would have been good, but maybe it's not available
at that time.
But you need it now.
True.
Okay. So my appeal to members, in the event that it's not there, but it's going to improve your health, let's see as things definitely get better. Yeah.
Then, Doctor, I'd also like to help. I would like to contribute to the gentleman who was raising the issue and saying then there are these other nurses. in any profession or any industry, we do have what they call interns. And I believe if you've worked in a system of government or any other serious institution, you have seen them. There is no way any of these nurses will be around if they're intern nurses, I'm assuming, or those undergoing training. There is no way they are unsupervised. By all means, they'll do a ward round with a doctor to see what exactly happens, because they have to also learn. The next time when they get to the professional level, like doctor told us at the beginning, you go through particular stages, they will be the ones to attend to you. Now, this one says, I'd like to appreciate the program on UBC. I am Patrick from Terego. Doctor, why is sickle cell disease commoner these days than before in children? That is from Terego. Then this one has got a question. Thanks for the show. I'd like to wish to know how deep do you go with cardiothoracic thing? He says cardiovascular system, like surgery, if you have that kind of surgery at the hospital. Many of them you would see this one is pain in the abdomen. I have hepatitis B, but quitting alcohol has been so hard for me. And what he talked about, the daily costs of dialysis for a kidney patient. You might just need to highlight that a little bit again for them of the hospital. Doctor, thank you for shedding more light about those services at Kiruddu. Please read my message to the doctor. Please don't skip it. Thanks. Yes, this one is really, really appreciative. This is Robert, and he says, thank you so much for the services being offered at Kiruddu Hospital. Like, I think he was watching from the start when you did the breakdown of what clinic happens on which day and what has been done. I have an issue with my skin where I get spontaneous skin irritations that appear every after 2 days. I've been taking cetirizine every time it appears up. I have any allergies that I know of. What could be the problem? I hope this is not an issue of self-medication where, you know, you keep on, or even the body, I think, gets used to the particular medication, and you'll find that eventually it cannot respond to that particular medication. Doctor, I would like you to respond to those.
Okay. Thank you again very much, viewers. I'll start with the last one. The one of the skin, please visit a dermatologist in Mlago so that they're able to ascertain what is causing. The skin can be a manifestation of disease inside. The skin, don't look at it as just a beauty spot. A lot of diseases that are inside that we don't see can have skin manifestation. True. So when you find something persisting on your skin, I would advise to take it seriously, and then you see a doctor to exactly tell what is happening. Then I'll go to the issue of sickle cell. Thank you for bringing the issue of sickle cell. I think the issue of sickle cell is not that it's now more common. I think the public awareness that has been rose by government, because government has put machines that screen for sickle cell in many of the health centers. So many people that would not have been detected before are now able to be detected and then eventually sent to hospital. I think many people were dying under 5, under 10, they would die and they would not know that what is killing them is really sickle cell. Now we're able to establish at an early age whether you have sickle cell, whether you're a carrier or you are definitely a full-blown sickle cell case. So maybe that brings the element of feeling that the disease is more common. No, my thinking is the ability to test now is higher.
Exactly.
That our diagnostic capacity has improved at many of the health facilities, and public awareness. Now at least many doctors are aware that when a child brings in fevers that are not going away and non-specific things and like this, I need to check for sickle cells. So which is a good thing now. And of course we know that if you are a carrier, please don't get married to a carrier, otherwise you're going to have children that are sicklers. So this is a message I think Ministry of Health has brought out to the forefront. So I'm glad it is catching up. At least the public is seeing many cases coming up. It's not like we're trying to discriminate against our people,
carriers,
the carriers, no. It's that please, if you're a carrier, then don't get married to a carrier. I like churches that insist on knowing, in addition to your HIV status, they will also ask and say, we want to know your sickle cell status. Because when you get full-blown sickle cells children, it is a very painful experience.
Yeah, true.
You're virtually in hospital every day. Survival, mortality rate of the children is very high. So I'm glad now if people have definitely picked up on this. Cardiothoracic services, I would advise that gentleman to visit the Heart Institute. That's where the cardiothoracic services are. At Kiruddu, I don't want to start deceiving you that we're able to give you that, because that is quite specialized care that only the Heart Institute is mandated to undertake. The gentleman saying that he has hepatitis B, but is also taking alcohol, it is really sad. It relates to the other one that I said, that you have hepatitis B and then you are taking herbs. Alcohol is like a herb. It's a drug that when you take, it is also broken down in the liver. But your liver is already diseased. And now you are pumping it again with more alcohol. That means you are now exposing it to a lot of double injury. The progression of deterioration in the liver function is going to be extremely fast. These are the people that we usually see that eventually end up in hospital. They have liver which is not functional. Unfortunately, our liver transplant services are not yet developed. So the best we can do is eventually symptomatic management. Please quit alcohol. It's one of the recommendations we say once you're found to have hepatitis B. Remove all other agents that are going to continuously challenge your liver. Alcohol is number one of those, because eventually you're challenging your liver to the detriment of your health. The other one is the issue of the dialysis costs. Like I said, a full kit to do dialysis is about 350,000 if you visited the private sector. 350,000 at Kiruddu. And that's why private facilities charge between 300 to 350. At Kiruddu, because government of Uganda invests into this service, we charge our patients 60,000, which is a sixth of what the cost should be. And I can assure you, like I said, even then, much as we charge 60,000, more than 80% of the people still can't afford that 60,000. The truth is, kidney care is extremely expensive worldwide. It is extremely expensive because you pay that amount of money and you come to hospital 2 to 3 times a week. That means for dialysis alone, you're paying almost 400,000 per week if you're just paying you're paying more than 200,000 if you're just paying 60,000. If you're in the private sector and you're paying 400,000, that means 1.2 million per week. If you're doing 3 sessions per week.
Per week, yeah.
That's about almost 6 million in a month. And I can assure you, very few of us can afford that. Unfortunately, the people who have chronic kidney disease don't just have the kidney only. They have hypertension, so they have to take drugs for hypertension. They have diabetes, they have to take drugs for diabetes. They have low blood, they have to take drugs for improving their blood. If you're coming from far and you're doing dialysis in Kiruddu, you have to rent a house in Kampala.
Yes, true.
Since if you are staying in Masaka, and that's where your home is, and then you are required to appear 3 times in Kiruddu. There is no way you can board a taxi every time you're coming for dialysis. That means you have to rent. So the costs that come around dialysis are quite enormous. And that's why, through Government of Uganda and Ministry of Health, and we are very grateful for this, we decided to decentralize dialysis services. We started dialysis services in Lira, we started dialysis services in Mbale, we started dialysis services in Hoima, Mbarara, and we're planning to see how this can be expanded in all the regional referral hospitals. So the patients avoid that journey of walking from up country to come and get permanent residence in Kampala.
In Kampala, too.
Yes, because it is very costly. Like I said, most of the patients that have got chronic kidney disease that need dialysis have got a lot of other diseases where you have to take medicine. Diabetes, you have to take medicine. Hypertension, you have to take medicine. Low blood, you have to take medicine. So you realize the cost of care of these patients is not just the dialysis sessions we're looking at,
but everything.
there are a lot of other things that this patient is spending on. And I have seen families go down, they have sold their land, they have sold whatever they've had just to maintain a life. I'm glad to report that eventually our transplant services in Mulago are eventually picking up, because the only exit from dialysis services is getting a kidney transplant. That means if you are eligible, because some people are either old or they have other illnesses that can't allow them to have. But those, at least our dialysis services, our kidney transplant services are picking up. So many people who are on dialysis can have some hope of getting a kidney transplant.
Okay, that's very good. I know we've run out of time. I can see the questions are quite still many, but I would like to say Kiruddu is open to you. I would just only like to take this person's appreciation. Thank you for the program. I really, with God's grace, thank all the doctors at Kiruddu. Thank you very much. The hearts of the doctors really exist there. May God bless you. That is to you and your team, from a person I believe who's gotten a wonderful service from there. I know you still, I feel sad.
Can I make some closing remarks?
Yes, some closing remarks, Doctor.
Briefly?
Yes, please.
Thank you very much, viewers, and thank you those who have been tuned in. My few parting shots are: one, health is made at home.
Yeah, true.
Have a healthy environment, exercise, diet, have a clean environment, sleep under mosquito nets. That's what I mean by saying health is made at home.
Yes.
It is only repaired in hospitals. If you make bad health at home, you're going to bring bad health to hospital. Okay, so we definitely want you to stay at home, and this is within your means. Two, I really strongly encourage for early screening and early detection, so that we can handle these diseases and have a better outcome. Three, report early to health centers to seek for care, and please adhere to treatment. Like I mentioned before, Government of Uganda has invested a lot in improving the health centers that are next to you. Some of them have been upgraded to hospitals. That means their functionality has been improved. So please make sure that you report. Avoid self-medication. I have seen you enter a pharmacy and someone is there buying very expensive medication that is a preserve for hospitals. Unfortunately, at a time when you need this medication, you will have already used them and they will have become very weak.
Yes.
So please avoid self-medication. Five, there's definitely need to strengthen intersectoral approach, because many of our people, we have bad habits. I've had stories where formalin is sprayed on meat, put in senene. As a preservative. Those chemicals are toxic to the body. So members of the public, I appeal to you, much as you want to make money, let's not harm our own health, because your brother, your sister who is going to eat this senene or the meat is eventually going to be affected. Lastly, we all have a role to play on this health. As I conclude, I'd like to send our appreciation to our patients who task us with their health. We're very grateful, because without you, we would not have any job to do. We'd like to appreciate the Government of Uganda, the Ministry of Health, that gives us the funding. I would like to appreciate my staff. Thank you, staff of Kiruddu Hospital, for serving selflessly, serving under difficult conditions. Sometimes we've had our own differences and had a fight, but it's all aimed at improving the quality of service that we give our people. We also thank other stakeholders that have supported us to provide care. Thank you very much, and thank you, UBC, for hosting us.
Okay, thank you so much, Doctor, for your time. I'm sure because your phone, I don't know how many missed calls he's going to find. His phone must have been ringing off the hook, because there are particular patients who are attached to particular people and they'll feel very comfortable speaking to them. But I believe he summed it up and said it all. For all of you whose responses, questions, concerns, appreciation have not been addressed, I believe you will find time to walk to Kiruddu Hospital. Now that at the beginning of the show, the doctor did a breakdown for you, which clinic happens where. In case you're not sure, you can go onto their website. The numbers are there and you'll be able to get a response. Thank you so much still for participating. Unfortunately, we're out of time. At this particular time, I'd like to hand over to Lunchtime Cruise. Let's get a little bit light on the day. We still have a long day to go. Bye-bye from me and from Doctor.
Hospital, and this is our ICU. Our ICU was developed and started in 2021 in response to the COVID-19 epidemic, and we started originally with 3 beds. We started as a 3-bed ICU, but as we could not fulfill the needs for the entire hospital and for the country, the ICU was expanded to accommodate approximately 9 beds. We usually manage patients who have respiratory failure, that's patients who are unable to breathe on their own. We're able to place them on our machines known as the ventilators, and we're able to give them